so I reckon we might get started. I would just like to introduce myself. I'm the co-chair of the Children and Family SIG Special Interest Group for the International Society of Behavioural Nutrition and Physical Activity. And today we are putting on a webinar for people interested in parenting practices around food and physical activity. Before we get started, I would just like to thank the International Society of Behavioural Nutrition and Physical Activity for allowing the special interest groups to be able to provide this webinar series for people, our members and others that are interested in this topic. And we are very fortunate enough to have two incredible researchers who will be delivering a presentation today. We've got Dr. Teresia O'Connor from Baylor College of Medicine in Houston, Texas in the US, and Louise Masse from the University of British Columbia, which is located in Vancouver, British Columbia in Canada. So I'm just going to introduce each of our researchers just quickly. So Dr. Teresia O'Connor is a board-certified practicing general paediatrician and fellowship-trained clinician researcher and an associate professor with Baylor College of Medicine in Houston, Texas. Her research is funded by the NIH and USDA and focuses on identifying strategies to best prevent and treat childhood obesity in clinical and community settings. Also, her research focuses on providing better understanding of how parents, particularly fathers and mothers, influence their children's obesity-related behaviours through the framework of parenting styles and parenting practices, and also assessing how to use technology to improve the measurement of children's obesity-related behaviours. Our other presenter is Dr. Louise Masse, who is a professor in the School of Population and Public Health at the University of British Columbia and a Level 3 scientist at the BC Children's Hospital Research Institute. Her current studies, which is funded by the Canadian Institutes of Health Research and the Public Health Agency of Canada, include evaluation of policy strategies and capacity building interventions to influence children's health behaviours, specifically physical activity, sedentary and dietary behaviours in multiple settings, including childcare, recreation centres and schools. Her research also focuses on developing and evaluating gamified lifestyle modification interventions targeting children and their families, as well as understanding how transitional periods, particularly the transition from elementary to secondary schools, influence children's physical activity, sedentary and dietary behaviours, as well as weight outcomes. Both Dr. O'Connor and Dr. Masse have collaborated to develop consensus methods for researchers to measure food and physical activity parenting practices. This work is funded by the Canadian Institutes of Health Research and it is co-led by Dr. O'Connor and Dr. Masse. Today they will jointly present their work and highlight the resources they are developing for researchers, and will highlight the need for standardising the measurement of parenting practices. The title of their talk today is Development of Item Banks for Food and Physical Activity Parenting Practices. And before I hand over to them, I just would like to tell you that this is an interactive webinar, so if you have any questions at any point during this webinar, you have two options where you can write down your questions. Down the bottom of your screen, you have a Q&A tab. Here you can just click on that and enter in your questions. Or the other option is to use the chat tab down below at the bottom of the screen too. So you can write your questions in there. And what we'll do is we will look at those questions and have our researchers and our presenters answer those questions at the end of their presentation. But still feel free to write those questions down as they pop into your head along the way. So without further ado, I would just like to introduce our presenters, and thank you so much for being able to come here today and present your research to our members and people interested in this topic. Thank you.
Thanks so much, Rebecca. And I'm going to get started, then Louise will do the second half of our presentation today. Thank you, everyone, for taking the time to join us. I know we're spanning lots of different time zones, and I think we're somewhere between Friday morning and Saturday morning for most of the group. So I appreciate everybody taking the time to join us. So I'm going to dive right in, since Rebecca's already done a brief introduction of our project and what we're going to be talking about today. Let's see if I can get this working. So just to briefly go over the objectives of today's talk, we're going to start off by reviewing some of the challenges that we see of how we've been measuring food and physical activity parenting practices. We're then going to go over and review the steps in developing item banks for both food and physical activity parenting practices, and describe the approach that we took to develop a consensus conceptual map for both, and then describe some preliminary psychometric assessments of the physical activity parenting conceptual map, which we are currently working on, and we're about to start on doing the same for the food parenting practice conceptual map. So I think with this audience, I really don't need to spend a whole lot of time convincing you why it's important to think about how parents interact with their children around obesity-related behaviors. I'll just leave it with many of the American associations, including the American Academy of Pediatrics and the American Heart Association, recommend that prevention and treatment efforts should be targeted at the family level when thinking about childhood obesity. And that's really true across most of the organizations in a lot of countries and international organizations. And to start off, I'm going to sort of take some time to provide you with some definitions just so that we're all on the same page as to what we're talking about. And I'll do that again in a couple of slides with some additional concepts that we'll be talking about. So when you think about how parents interact with their children, most people in this field either talk about parenting styles or parenting practices. Parenting styles is a more global assessment of the parent-child relationship. It includes the parenting behaviors that parents do, but it also includes the emotional climate that parents set up with their children. And so really captures much more of that relationship, and it crosses multiple different contexts. Parenting practices, on the other hand, are often described as context-specific, and they're parental actions to influence a child's behavior. And so for our purposes, we're going to be talking about the context of food, feeding and eating behaviors among parent practices. When we first started this project, one of the things that was becoming more and more apparent to us and to others was that over the last couple of decades, there was a growing number of studies that was looking to assess parental influences on how children's eating and feeding behaviors, as well as their physical activity. And with that growing number of instruments that were being developed, the researchers that have developed them would focus on different constructs, but there was really no consensus as to what were the important constructs to measure, and there was also no consensus on what specific items should be used to measure that construct. And so to illustrate that, one item that a lot of people are familiar with is the idea of offering or rewarding your child with sweets or desserts if they finish either their meal, their vegetables, something like that. And when you looked across published instruments, and these are 5 examples listed here, 5 different research groups put that under 5 different constructs. Either instrumental feeding, parent-centered feeding, practical methods, pushing the child to eat more, and the use of rewards. Each one of them may have done so for different reasons, but what resulted is that we really had difficulty in comparing findings across studies. and also to aggregate findings between studies so that we can start looking at meta-analysis and other things. And one of our goals was to start getting more consensus across research groups so that when we are talking about a food parenting practice construct or a physical activity parenting construct, we have clear definitions of what those are, and everybody around the table and in the research community has the same understanding of what that is. The other thing that I think has become more and more apparent, and there's a growing recognition that parenting practices aren't done in isolation. There's a bi-directional relationship between what parents do, their parenting practices, and child behaviors and characteristics, and that they influence each other, such that parents that may act differently with different of their children, and they may change how they interact with their child in a specific context based on how their child's behaviors or other characteristics may change. And the instruments and tools that are available right now are oftentimes long and may be cumbersome to actually be able to assess these bidirectional relationships very frequently. Most of the research studies that have looked at bidirectional relationships between parenting practices and child behaviors to date do so over longer periods of time. There may be months or even years between the time the parenting practice and the child behavior is looked at in a bidirectional effect, whereas those relationships may actually occur in much shorter intervals. And so having tools that we can assess parenting practices and child behaviors more efficiently may be helpful to further investigate these bidirectional relationships. So as we were thinking through this, we were pondering what would we need to help solve this problem. And our feeling was that whatever we do really needs to be comprehensive. A lot of people are interested in this area of research, and we need to make sure that whatever instruments and tools we provide at the end cover a lot of different parenting practice constructs, and that researchers and investigators can select to use the entire tool kit that we have, or maybe just select the constructs that they're specifically interested in a intervention or other study to help them answer questions. We also wanted to make sure that our ultimate tools that we develop are developed systematically. They need to be built on existing models. There's been years of research already in this area, and a lot of thought put in by a lot of very engaged researchers, and building on what's already known is going to help propel this field forward. We also wanted to make sure that we got input from researchers in the field. Our goal is to develop tools for us and others in the field to use, and in order to make sure that we are covering issues and concepts that others are interested in, we really valued input from researchers. We also, one of the big things that we wanted to address was to allow more comparisons between studies using new tools. And then lastly, to result in more efficient tools that can allow for more frequent assessments that can address some of the investigations into bidirectional relationships of parenting practices to child behaviors, as well as potentially other interesting research questions. So to address this, we decided to take a similar approach to what the NIH PROMISE group did. So PROMISE stands for Patient Reported Outcomes Measurement Information System Initiative. And this was an initiative led by PROMISE. It's now housed by Northwestern University. You see the link down below where you can look at it more. And their goal was to provide a systematic approach for having standardized forms to measure adult patient self-reported health outcomes around physical health, mental health, and social health. And you see some of their primary constructs that they were interested in. They wanted these standardized forms to be able to measure either a construct that the researcher could pick to address only one or a couple of them, or to be able to use these tools in order to look at profiles across multiple of the constructs within these domains. The other thing that the Promise Initiative did, which we thought was very interesting, was to use computer adaptive testing, which was an area that was really developed in the education area to help improve standardized educational assessments of students so that you can minimize the number of questions asked of students in tests. So computer adaptive testing will allow that items are dynamically selected from an item bank based on the response previous answers on previous items in order to measure a construct. And the goal is really to reduce the number of items that need to be asked to still have a high level of measurement precision. And within the NIH Promise group, they were able to use this computer adaptive testing, which relies on item response modeling, to generate these item banks, to limit the number of items per each of these constructs to just 4 to 12 items. So our goal was to use a similar approach. And to do that, we really saw that we needed to do this in a stepwise approach. So I'm going to outline the 5 steps that we took to generate these item banks and allow for the potential of using computer adaptive testing of food and physical activity parenting practices moving forward. And the goal is really to create this repository of psychometrically valid items of parenting practices for both of these areas and to move this field forward. And so first we needed to see what was currently out there. We conducted, each of these steps were done separately but in parallel for then food parenting practices and physical activity parenting practices. So we created systematic reviews of instruments that have already been published. We then spent some time conducting some studies to supplement that with parenting behaviors that maybe weren't currently captured with the existing published instruments, but that parents still reported doing. And then we went to the experts in order to develop conceptual frameworks around both of these areas and have consensus among experts as to what are the key constructs to measure. And the 4th step was then to develop item banks for each of these constructs from the conceptual framework, and those were generated based on steps 1 and 2 and an iterative process. And lastly, step 5 was then to start psychometric evaluations of these items to see how well they captured the key constructs that our expert panels had identified. One of the things that I want to sort of also mention at the start of this is that our focus was on parenting practices of children between the ages of 5 to 12, so elementary school age children. We realized that a lot of people do work in preschool and adolescence as well, and potentially in the future this can be assessed in those age groups as well, but our focus right now has really been in that elementary school age, primary school. So I'm going to outline steps 1 and 2, and then I'm going to have Louise take over and tell you about steps 3, 4, and 5. So for step 1, our goal was to populate the parenting practice item bank with items from published instruments. And so, as I mentioned, we did systematic reviews, both for food parenting practices and physical activity parenting practices. We're not going to have the time today to go into a huge amount of detail of this, and I encourage you to look at the published manuscripts if you have a specific interest on some of the details of the methodology we used. And if people have specific questions, maybe we can address it at the Q&A at the end as well. So for the food parenting practices, we identified 79 published instruments that had a total of 1,392 items. For physical activity, we had 74, or we found 74 published instruments with just over 600 items. And you can imagine with those number of items that there was a fair bit of overlap across instruments in which similar items were used in multiple items. And in order to be able to collapse that and condense it down, we use the same approach that the NIH Promise group did by using binning and winnowing. And to do that, we developed a coding system that we describe in these two papers to be able to code all the published items and then group similar items in a binning step, and then review all the items under each bin and consolidate items into parenting practice concepts that were all similar, and that's the winnowing step. So for the food parenting practice items that were just over 1,300 to start with, we were able to reduce those down, and the same for the physical activity. So again, I'm going to pause for a second and go through some definitions really quick, just to make sure that when I use terms, everybody's on the same page. Most likely, most of the people on this call are familiar with the concept of a construct. A construct is an explanatory variable that's not directly observable. And so within parenting practices, an example is role modeling or praise and reward. An item, on the other hand, is an indirect way, when asked in combination with other items, to measure a construct. So an item that we found published in the literature was, I reward my child with an ice cream if he or she eats all of his or her vegetable at dinner. And essentially, when we looked across the 79 published instruments, we found a variation of that item in 43 of the published instruments. So in that winnowing step, we were able to reduce that down into a concept. So in our work here, we define a concept as a representative statement of multiple similar items, all assessing a similar concept. So we took all of those items that were similar, and we reduced it down to, I reward my child with something tasty, for example, dessert, as a way to get him or her to eat a food. And that food may be a vegetable, it may be dinner, etc. And then as we move forward today, we're also going to be talking about some dimensions. So these are higher order categories that include multiple constructs. So for example, structure that parents create within their parenting behaviors will be discussed for both of these categories today. So within the the populated items that we had from the published literature, using the binning and winnowing technique that I've described, we were able to reduce the number of items into 231 concepts for food parenting practices and 100 concepts for the physical activity parenting practices. Moving on to step 2, we then went and wanted to see if what's been published really captures what parents do well. So we conducted a semi-qualitative study with parents from the US and Canada, all who had children between the ages of 5 to 12 years old that were healthy. We recruited them through an international internet research polling firm, and they were sampled to try to get equal number of parents with children between the ages of 5 to 8, as well as 9 to 12 years old, so we get some good distribution across the age group, and then represent the ethnic diversity of the country that we were working in, and have equal distribution of high, moderate, and low SES within the ethnicity. And these parents were then asked 6 open-ended questions online that they were able to respond to. And again, the questions and a lot more details provided in publications if people are interested. So we had a sample of 135 parents, 74 from the US and 61 from Canada. About 40% in both countries were fathers. The majority of the parents that participated were married or common law. And you see that just over half reported their family income below the median of that country. And the racial ethnic distribution of the sample captured what is relatively representative of the population of those two countries, with slightly higher overrepresentation of the ethnic minorities, so that we made sure that they were represented. Of those 135 parents, they responded both for food and physical activity parenting practices that they did. And for the parent responses, we had over 2,300 ideas of what they did for food parenting practices and over 1,300 for what they did for physical activity. And similarly to what we did with the published instruments, we went through and coded them and used binning and winnowing to be able to reduce that down to 194 unique parenting concepts that the parents reported doing for food parenting practices and 110 for the physical activity parenting practices. And when we combined that with the published literature, we had a total of 262 unique practices for the parenting practices. So these are concepts, and then 126 parenting practice concepts for the physical activity. And we did do some comparison between these, and I'll just touch on it lightly here, and we can maybe get into more details later if we have time. But just over 60% of the concepts that we had at this point represented concepts that both the literature had and the parents reported doing. That's in the orange of both of these pie graphs. The green represents what the literature only reported. And so for the food parenting practices, that was 26% of the total concepts. And for physical activity, that was 13%. And of interest, there were concepts that only the parents reported that weren't currently captured in the literature, and that represented 12% of these concepts for food parenting and 20% for the physical activity. Realizing that the next step was to get experts involved, we realized that having that many concepts for our experts to review was still challenging. So as a research group, we went through and did a second round of binning and winnowing, looking at concepts to see if they could be further reduced. And we were able to reduce them down a bit further by combining meals a little bit more, not separating things by separately for lunch and dinner, etc. And we're able to reduce it further down to 110 unique concepts for food parenting practices and 77 unique concepts for physical activity parenting concepts. And with that, I am going to take a pause, and I'm going to let Louise take over and have her share her screen, and then we can
So I'm gonna, I think I'm at the right screen. And thank you, Teresia, for providing an introduction. And so I'm gonna move forward. And for some reason I don't have my video, but I think I'm gonna leave it like this. So what I'm gonna do is I'm gonna move forward with the presentation to talk about how did we develop the conceptual framework with the expert, develop the IDMEC, and what's the process for the psychometric evaluation. So the development of the conceptual framework for the food and physical activity is that we went through very similar processes and parallel processes that we use expert from the scientific community. And our goal was to identify the concept that should be included into the food and the physical activity conceptual framework. And what we did is we recruited experts for both the nutrition expert as well as physical activity expert. You could see on this slide how many we invited. We invited about 32 experts from the nutrition field and ended up with 25 who participated in this process. And for physical activity, we invited 30 and ended up with 20 that participated. And you can see the response rate. You can also see on this slide that we also try to involve people from various countries that were conducting research in this area. And we listed on the slide the various countries that have participated in this process. And what we did for the expert panel, what was the task of the expert panelists that they were asked to do, is that what they were asked to do is, Teresia talked about the concept that we identified from the literature and the parents, that we identified 77 concepts for physical activity, 110 food concepts for nutrition or the food, area. And we asked the expert to sort of take these concepts. So the physical activity expert had to look at the 17 concepts and say, which one are measuring something similar and then can be regrouped into the same construct. And they had to do this for all the constructs to sort of sort them into piles in the same, like a pile sort type. And I had to name each of the group. And the physical activity expert had to do the same thing, except the expert were provided in addition the framework by Vaughan that was published at the same time we were doing this, that we wanted to make sure that they were familiar with that framework. They weren't necessarily told to use it, but we wanted to make sure that they were familiar with the framework. If they felt that it was relevant to use, it would provide some level of validation of using a similar framework that had been published. The whole process was conducted online, and it was conducted using the concept mapping software system. And what we did when we had the data collected is that we analyzed that data, essentially all of the individual sorting that each of the expert did was analyzed using non-parametric multidimensional scaling analysis. Basically what it does, it creates a map. It's a two-dimensional map that shows how close or similar some of the concepts were sort of put together by the expert. And I'll show a visual of this after this. And we follow that with an analysis, doing a cluster analysis of that solution. But the process is actually not quantitative as much, although we had some quantitative data. The process is actually used when you use concept mapping analysis, is that it's highly driven by reviewing the quantitative data to make sure that it makes substantive sense to us, and that we actually think about conceptually what makes sense to regroup together. So our team took the lead in doing this, but we also involved the expert panel in terms of reviewing and making sure that they were providing feedback. So this is an example of what the two-dimensional map looked like, the symmetry matrix map looked like for nutrition. What you see here is that there's 110 dots, and then they all have a number. Each of the number represent a concept that the expert had to sort. And the two-dimensional symmetry matrix will actually co-locate concepts close together if many of the experts would have sorted them in the same pile. So you could see definitely like clumps of items that many experts sort of agree that should be together, and then the further they are from each other, then they're less related. But that map is actually hard to analyze. This is where a cluster analysis is done in this map to sort of look statistically how often some items were sort of grouped together, and that was the next step. This next step shows actually a bit more in here. This is again the food parenting solution. It's the concept map that shows the cluster analysis. And there's a lot of information on this slide. I'm going to try and simplify a little bit what we see here. But what you see here on this map is you see a lot of areas that are shaded. Every area that's shaded it actually shows the statistical solution. So there was actually 16 clusters that was statistically identified. But as I said before, that process is not statistically driven, as the statistical solution is used for us to qualitatively review and then to give us a starting point. And then what we do with this is that we actually look what makes conceptual sense, and then we make suggestions based on that initial solution. And then what you see, the change that you see, the overlay on it, is the shape that we have drawn in black is actually what the proposed solution that our team came up. And it was an iterative process of us coming up with a solution, having our research team agree, and eventually presenting that solution. So what you see on this complicated diagram is the final solution of the construct that we agree with the expert. And this is one of the solutions. For nutrition, we ended up with two proposed solutions. And then the final solution identified 17 clusters that we regroup into the main dimension of the parenting practices using control, structure, and autonomy support. And actually, the areas are actually shown also in the graph as well. And as expected, control would actually include a lot of the practices that we consider to be somewhat negative in terms of having the parents that pressure the child, and it includes, for example, restriction for weight, what the parents may do in terms of controlling the child behavior, but with the intent of controlling the child's weight, or using food to control negative emotion when the child is not easy to handle, or using threats and bribe in order to get the child to do certain behaviors, and using food as a reward, and pressuring to eat, as well as using some intrusive control strategy, which is essentially trying to control the child's eating behavior without the child being necessarily aware. And structure regroups all of the construct that the parents use to actually create an environment that should promote healthy eating, such as prompting the child to eat, having rules and limits, providing expectations, and permissive feeding also fell into that, or how or what is available or accessible in the household or made available. Food preparation, whether the parents model healthy behavior, whether the child is exposed to a variety of selections and different food, whether the parents structure the meal environment that is healthy, or whether the parents use redirection and negotiation. And the last one is autonomy promotion, which is expected to actually promote self-regulation in a child in terms of what the parent does to involve the child in making decisions about eating, encouraging healthy eating, and whether the parents sort of help educate and reason with the child in terms of the decision that he or she makes about parenting. One of the things that we did notice is that we had a subset of experts that also tried to come up with a much more parsimonious solution. And so our team debated as to whether we should have a more comprehensive solution or parsimonious solution that sort of collapsed the 17 cluster into 7 that are listed here. And you see some overlap, but you see a lot of the smaller cluster being regrouped here into larger construct, and they are still listed here. And if you do want a more detail, we have all of the reference for these. And we were actually quite interested in presenting the 2 solutions, but we were not sure how the expert would sort of react when they saw the 2 solutions for nutrition. So we decided to actually present the 2 solutions and make them decide as to whether they have a preference for one solution versus the other one. And that slide sort of shows the preference for the more comprehensive solution was higher than the parsimonious solution, but there was still an appetite to actually present both. So we ended up presenting in the paper both because we had some discussion as to, certainly we saw that the first solution sort of adhered to a lot of the construct that we're presenting in the literature that was much more in line with some of the theory that are out there. But we also saw great promise in looking at more parsimonious solution because it could potentially facilitate a little bit more understanding on how it influences a child outcome when we think that perhaps what we need to look at is a profile of parental behaviors. So we're not sure whether the 2 solution will be helpful, but at least these conceptual solutions will sort of guide our analysis of the data, and then we will be informed with the data that we have collected from the psychometric to sort of get a sense whether the more comprehensive or even both solutions are somewhat valid and useful. For physical activity, we ended up with only one solution in what we presented in our final paper. And then again, you see the same thing, that the shade in gray is the statistical solution and how it ended up being reworked when we actually looked at it more conceptually and thought about it qualitatively and substantively. You can see the shape that we have overlaid and what we ended up in terms of the factor. And we again present for the physical activity using the same kind of domain or dimension of parenting, except with some slight differences between the nutrition and physical activity, because we have, instead of having a control, we have the neglect and control that we group pressure and permissive together, because we view these 2 behaviors as being negative. Like certainly pressuring is not something that promotes self-regulation, but permissive is not actually kind of positive as well. So we wanted to have it regroup with the pressuring. And autonomy support, again, how the construct that sort of help structure the environment so that the a child could be more physically active, such as encouraging, providing some choice in terms of how they are physically active, involving, having parents that are involved in their physical activity, and praise and rewards. And the structure, so autonomy support is about structuring the environment for promoting self-regulation, and structures actually try to encourage physical activity. So co-participation with the parent, having expectation, and facilitation, which we know is a big part of what parents do in terms of making sure that they are taking their children, enrolling their children, modeling a healthy behavior, monitoring. We also had another dimension that was restriction for safety and academic concern that ended up being combined, even though we think safety and academic is kind of different. But that's something we're sort of assessing with our psychometric to see if that's going to hold separately. So once we had our concept, the next step for us was to develop the item bank. And so recreating the item, as you remember, we talked about having the expert sort concepts. So they were not items that they were sorting. But we knew that when we had a concept that was sorted into a construct, that there were probably a huge number of items, and then a lot of them would have a lot of redundancy. But at least we could go back to original item and see how people actually wrote them in the literature. So we didn't start from scratch because we went back to the existing literature. We also went back to the parent responses and sort of given us an idea how to create items. In some cases, we still had to create some new items because we felt like it was somewhat imbalanced for some construct that we didn't have enough items. While we were taking the items for many instruments, many sources that were published, we had to standardize them. And it's also something that we noticed that when we look at the NIH Privacy Initiative, they run into the same problem that if you take things from multiple sources, even the response format or the way the items are written is quite different. So we had to standardize them. So we ended up creating an item bank for the food and an item bank for the physical activity. And then we had to cognitively test them. In total, we had 26 parents, about 16 for the food, and then 10 for the physical activity that sort of review and gave us feedback on the items and help us sort of fine-tune how they were written. We ended up with a large set of items for the food, 129, so large for the physical activity, with the intent that we thought that the final scale would be smaller, but we wanted to make sure that at least if we had some ways of asking similar question that we weren't sure which one was better, that we would test various ways of asking a similar construct, so we would pick the better way of phrasing the item. The psychometric evaluation consists of validating the proposed conceptual framework. And what we did for that, for collecting the data, is we used web-based panel sample that was provided by Insight West. And the sample was only in Canada in this case, and we use a quota sampling procedure to ensure good representation across characteristics of the participant. And we focused on parents of 5 to 12-year-old, again, because that was the focus of our study. We made sure we had good balance of parents that would respond for a younger child, 5 to 8 versus 10 to 12, actually an equal split. We wanted to make sure we had parent gender and enough that we had fathers, because fathers are tend to be underrepresented, and we wanted to make sure we had that. A good balance of ethnicity and a good balance of income as well. And you can see here sort of the distribution and then the size of the sample for the physical activity, and then the food parenting practice, our data collection, what we're going to conduct a psychometric. So the sample size for the physical activity is about 600, and then for the food about 800. And then we were, that's one of the good things about using web-based panel, is that we are able to get certain characteristics of participants. We have good fathers, representation of fathers. We also have a good split in terms of low income, below the median of Canada, and some variation in ethnicity. Percent white is around 50. We oversample for ethnic minority in that sample as well. For the physical activity, we have funding to actually do a sample of children that would fill out questionnaire, and they would be 10 to 12 years of age. And we have a smaller sample of 122, so the parent and the child data can be linked, and we would be able to do some further validation on the physical activity. We actually do not have that funding for the food parenting practices at this point. So our plan for the psychometric evaluation is, as I mentioned, is we want to check whether our conceptual framework, we have the construct we expect to have. And we also want to look at what we refer to as structural invariance. So when we find that the psychometric properties sort of hold for a sample, we want to make sure that the property are invariant across properties of the examinee. For example, gender is a good one that we could look at. We want to make sure that the construct that we're measuring would be valid for both mothers and fathers. We'll be looking also whether it be valid, whether you have low versus high income, and we'll look at different characteristics of participants to look at structural invariance. The techniques we use for this is we use both what we refer to as classical and advanced test theory. So we're using comparative fact analysis, item response theory, and we'll be using that differential item functioning, which is basically a method to look at structural invariance in our sample. And for the predictive validity, we have some opportunity to do this for the physical activity, where we're looking at parenting practice, and then we see how this predicts children's self-regulation as well as physical activity behavior. So we'll be looking at some of the hypothesized relationship that we expect to see with our construct and child-related behaviors. So where we are so far is that we have a fair amount of work done in terms of looking at the psychometric property for the physical activity items in the conceptual framework, and we will be able to present the analyses at the ISBNPA in detail, and we started in the food. What we have so far when we look at preliminary psychometry, I'm not going to spend a huge amount of time on this, but basically when we look at a conceptual framework, what the expert wanted to have or see in terms of the construct we'd be measuring is that we see that we are able to sort of find these dimensions with some small modification that we're not finding in terms of in our preliminary look at the data. But so we have some initial support for the physical activity conceptual framework. And what we are exploring at the moment is we're exploring whether we could have what I refer to as a higher order or a simpler solution that would explain the data. Is that certainly we had that discussion for nutrition, is that, well, we find like 17 construct in nutrition. That's a lot of things to look at when we try to see like what parenting practices influences children's health behavior. And for physical activity, you have 12, but it still is a lot of things that we're looking at. And then I know the literature has looked toward, quite often to look at specific parenting practices, but we see a shift now in the literature where people look at profile of parenting practices. Is that, for example, if, parents use, guided choice or is highly autonomy supportive, but also pressuring, it's going to work very differently if you're autonomy supportive, but it are much more less pressuring. Is going to have a totally different influences or potential impact on the child. So we think that perhaps like thinking a way of looking at the data or thinking about simpler solution might actually help us. And so this is where we are at the moment, to think about how to look at the data in a bit more simpler way. And then I'm going to finish this talk by talking about why do we want to have an item banks? What's the value of an item bank? And what's the utility of an item bank? Is that when we think about item banks that are calibrated, basically like you're using the calibrated items into your research, is that it could support a variety of administration strategies. I've listed 3 here. You could administer the test like the way we've developed it, use a fixed form. Basically, if we have 15 items to measure a construct, you would use all 15 items. Or you could use a tailored form, which is a mix of items from the bank with new items. You could say, well, I don't want to use the full 15 for that construct, but I want to use, key one and add new things. That could be supported as well. Or the vision is to also, hopefully, if the scales are long enough, we could consider computerized adaptive testing, is basically what Teresia talked about, is we stop the administration when you have enough information. And essentially it starts where you have an initial question, and then you have to have more than one, but when you have a few, you could estimate someone's score, and you could stop if you have enough precision, basically that your confidence interval in terms of what the person test score is precise enough. And if it's not precise enough, you continue administering. So if the scales are long, for some examining, you could yield more precise score with fewer items, or you don't actually need to actually administer to have, you know, enough precision in your instrument. So to summarize is that we have a few next steps that we need to sort of finish in terms of follow-up, in terms of finish up the development of our item bank. So we're finalizing the calibration of the item bank. We are going to be making the item bank accessible to the researchers, and I think some people have already expressed an interest in getting access to them. And then eventually we'll move to assessing the utility of using computerized adaptive testing, whether we could gain some efficiency by using that procedure. So we think that there's value in using the item because we want the items that we have measured construct that have been endorsed by experts. And then use of the bank, if people start to use the bank in terms of how we measure specific construct, we'll start making some progress in comparing results across study. At the moment, it's really hard to understand how do we move the field where we can't really compare results across study. And I think Teresia made a really good example at the beginning of her talk showing how one item, and depending on which instrument you use, is classified under a different name or different constructs. So that becomes very difficult for us to make any progress. And if we're able to implement CAT, computerized adaptive testing, then we'll have even more flexibility in solving measurement issue in terms of being able to develop shorter instruments with more precision. And then Teresia talked at the beginning of her talk about some example where we want to look at, for example, and I'm going to add like looking at parent variation in parenting practices. One of the things that we often do is we measure parenting practices, one time, but we know that it's probably changing as the child age, and we probably have a need to measure parenting practices more often over a period of time. And people that work in ecological momentary assessment are probably quite familiar with that and know that longer instrument is really not going to work. And then to look at mechanism of intra-individual variation or feedback loop, and it's basically the similar way of presenting the example that Teresia talked at the beginning, is that we often want to look at parenting practice that will influence child behavior, but child behavior can influence parenting practices. And then to really look at that dynamic association probably require a bit more measurement, more frequent measurement. And unless we have more precise and then shorter measures and standardized ways of doing this, it's going to be very difficult. So one of the things that we have as discussion point and feedback, we know we can't have a discussion in a webinar format, but we invite you to send us feedback or input on a few key issues in terms of whether computerized adaptive testing would be of use, whether you would benefit by having shorter instruments, and whether it'd be helpful to measure higher order dimension or much larger construct into the field. So we've included in our slides either an email for Teresia or myself. So if you feel like sending us feedback, we really would like to hear about these issues from people who are or need to use these measures. I'm going to conclude my talk with making sure I highlight the contributors to our work and our co-investigators, Dr. Cheryl Hughes, Tom Bernowski, and Mark Bosha. As well, I want to make sure I highlight the trainees and who's funded us. And I want to make sure I acknowledge the expert contributions. So you see here the list. I'm not going to name them all, but it's everybody has been part of the expert panel. Without their help, we wouldn't have been able to conduct this work. And then I know that all of these people are quite busy, so we are quite grateful for all of the input we have received from these experts. We have included the references to our everything we presented today, and then I'm just going to end here and open it up for discussions. Thank you.
Thank you so much, Teresia and Louise, for that presentation. It was really thought-provoking and definitely some like a way into the future on how we can progress this field around parenting practices and get more consensus across or globally with the research that we're doing. I'm going to open this up now to questions. So if any of the listeners have questions, now is the time that you can write these down and we'll get our presenters to answer them. So like I said at the beginning of the webinar, you can use the chat function, which is at the bottom of the screen, or the Q&A where you can type in your questions. So just while you're having a think about what you would like to ask our presenters, I'm actually going to ask a quick question just to kickstart this discussion. You were talking about looking at individual behaviours or parenting practices versus looking at a profile. How important do you think that is to move towards the profile of parenting practices? And do you think that this item bank will be able to help accommodate this shift in the way that parenting practices is conceptualized?
So I'm going to let also Teresia answer if you wanted to, but one of the things that it's becoming obvious to me is that we've often looked at the parenting practices individually to see how it influences children's behavior. But two parents could be using the same practice, but then their overall the way they interact with their child, may not have the same impact in terms of how the child will react. So it's much more complex. So we need to start thinking about not looking at these individual practices like when we looked at the nutrition, when we have 17 constructs. I don't think we should continue looking at how individual practices relate to behavior, but maybe start thinking about specific profile. And maybe certain practices are important to look in isolation, but we need to look at profile. And certainly the item bank, I think will always be, if people start to use the item bank and then use similar definition, when we start looking at these association or these profiles, at least we'll have some level of similarity of how we define it. So that's one of the reasons why we hope that people will start using at least the way things are conceptualized and defined. I don't know if Teresia, you wanted to add anything else?
I don't think I have anything to add on that right now. I agree that it probably depends also on the research question at hand as to whether or not looking at constructs themselves or profiles of constructs is going to be useful. My guess is that it will vary some, but I full-heartedly agree with what Louise is saying, that that when parents interact with their children, it's not a single behavior or a single construct that the parent engages in. It's really looking at all of these in combination. And so that's what profiles can add to what we're currently doing. And there's been some interesting papers. We have one published actually from a few years ago now where we try to do that. But I think as we get to a stronger consensus as to how to measure these constructs, we may be able to get to a stronger consensus as to how to start looking at profiles as well, which I think will be useful.
Excellent. I have a question here from one of our attendees, and they say, will you be carrying out a similar process for assessing eating behaviours in children?
We don't have plans on doing that right now. I think it would be lovely to do this across all, several child behaviors, in fact. I will say that this project has been quite a few years to get through the steps where we are right now. So if somebody else has the desire to do it for eating behaviors, I think that would be tremendously useful, but we don't have plans on doing that ourselves.
There's also a need to actually expand it for sedentary behavior, because we ended up doing physical activity and then food, but sedentary behavior has not been a part of the physical activity item bank. So then definitely sedentary is another area that is in need of being completed.
I saw another question pop up on the chat asking how much time would it take to complete the whole item bank. And I think, Louise maybe can address this as well, but I'm not sure that we have an answer to that yet. We don't have the final list of items because we don't have our final psychometric analysis down on the physical activity. Our goal is to reduce it down to the least number of items that we feel like are needed, and whether or not the CAT approach can then reduce it further within each study, that would be ideal. Louise, do you have any other comments?
Yeah. So it is scary when you see an item bank that has 100 items, but in the initial psychometrics, usually it's actually helpful to have more items that you need. And so we certainly follow that criteria, because when, I'm hoping it probably will be reduced by half, but I don't really actually exactly, because we're still fine tuning the number. But we definitely, try various ways of asking the same questions, which will increase the reliability, it doesn't increase validity, like there's not more content. So we're actually weeding this out in terms of what needs to stay, in terms of what is, core items that are measuring a specific behavior, and then try to eliminate redundancy in the question. So yes, they're actually very scary at the moment in terms of their length. But the idea is that we don't expect that all of the items will remain, because we build it with the idea that we would need to actually find the best item, and then sometimes we would have multiple ways of asking similar question, but we weren't sure which was the best way of asking it. So we were at the stage where it was fine for us to ask more questions, but I can't see people for physical activity parenting being able to administer the full set, because this is way too long. So we're hoping that it'll be somewhat reduced. Well, we know it's going to be reduced, but we're still working on fine-tuning the actual numbers. So at the moment, stay tuned. We hope to have it by ISBNPA, the final numbers. Yeah.
Great, thank you. Well, we're coming up to our the time to close the webinar, but just to finish off, and this may be interested, other attendees may be interested in this question, is how can people interested in this get access to the item bank, and when will it become available?
So we haven't yet created a website for making it available. So if anybody is interested, they could either email me and Teresia, and we could start working to see who is able to use it, and we would be in a better position when our psychometric is finalized, because we could tell you which item. But then if you have a need to do it sooner, we could tell you to use more item, which is actually a bit problematic at this point, because you always want least number of items. But we are definitely always available to try and share that information sooner rather than later.
Great. Well, thank you so much again, Louise and Teresia, for that wonderful presentation. We're very lucky that you agreed to do this webinar for us. We have recorded this webinar, and this will be available on the International Society of Behavioural Nutrition and Physical Activity website. So if you would like to watch this webinar again, or if you have colleagues that you think would be really interested in this, please feel free to share it. And I believe you will be presenting at the conference in Hong Kong as well. Is that correct?
Yes, I have two oral presentations in Hong Kong on that topic. Yes.
Yep, and I'll be there as well.
Wonderful. So if any of our attendees want to find out a bit more, please source out these lovely ladies and hit them up at one of our breaks during the conference and have a chat to them about it. And we hope that you will also, if you're not a member already, join up to our Children and Families Special Interest Group. We would love you to be part of it. And we hope to see you there at our annual conference in Hong Kong in June. So again, thank you so much, everybody, and I hope you got a lot out of today's webinar. Does Louise or Teresia have any final comments?
No, but thank you for having us present today. We were happy to be presenting our work.
Yep, thank you so much.
All right. Thank you very much, everybody. That completes our webinar for today.